Yeah, there's lots of new, exciting elements to the new UNIPAC. One is we've completely revamped the clinical scenarios so that they're much more in line with the content and really sort of direct the learners to think about the more research-based stuff in the context of a case. And so they're not so separate as they were before, they're much more sort of integrated with one another.
Having the cases allows the reader to then sort of apply that knowledge and apply what they've just read and think about a real scenario with the patient. Just gets us that much closer to what we do in practice when you can actually contextualize some of these concepts and apply it to a real patient.
Primarily for hospice and palliative care providers, whether or not they're new to the field, doing their fellowship, interested in it as a resident or medical student, or even for the more seasoned providers. There's definitely content that is new and fresh for each one, particularly as we update with the recent literature. Outside of the field of hospice and palliative care, I think anybody who's taking care of patients with serious advanced illness, for patients that aren't responsive to curative treatment, this book has content for them, whether that be an intensivist, oncologist, or internist or family practice physician. There's lots of relevant information for them as they try to talk to their patients and come up with treatments for those patients.
But these books can be used by anybody who takes care of folks with life-limiting illnesses, whether it be in the field of nursing, social work, or physicians or physician extenders.
The amplifier really is supposed to serve as a tool to help learners understand, did I really integrate the knowledge that I learned, and can I apply it to real-world situations? And the amplifier helps tease that out. In addition, the amplifier is great because you can use it for CME or MOC credits. So in addition to assessing your knowledge base and where you need to fine-tune or where your knowledge is good, it also serves as a great resource for CMEs and MOC credit.
I've taken a fresh look at a lot of these modules, and with the idea that the better quality of an assessment product or a self-assessment product that Amplifier is, the more likely that the readers are going to feel confident in what they've read and feel confident in what they've learned. This is the kind of book series that's unique in that each book is individual. Each book could stand alone by itself, whether it's a pediatric palliative care book or one of the chronic disease books. I think that makes it very unique in that it's not your typical textbook.